Welcome to the Back on Track Achieving Healthy Weight Loss podcast. I'm your host, Dr. Alicia Shelly. Now, this month, we have had some great news in the field of obesity. First off, Zepbound has been FDA approved for weight loss. Now, when I tell you I've been looking out for this drug for the last year, I've been hoping. I was telling people it's coming out in 2023. It's coming out in 2023. And the FDA did not make me a liar. in 2023. And so today we're here to talk about everything about Zepbound with Dr. Carolyn Francavilla Brown. She is board certified in family medicine and a diplomat of the American Board of Obesity Medicine. She's also the owner and founder of Green Mountain Partners for Health in Lakewood, Colorado, where she practices family and obesity medicine. She also runs the Colorado Weight Care Program, where she focuses on treating weight to improve and prevent medical problems. She also hosts the podcast, The Dr. Francavilla Show, a podcast on weight and health. Welcome to the show, Dr. Francavilla.
Thank you so much for having me, and I share your enthusiasm for Zepbound. I am so excited this med is finally here.
Yes, we've been waiting for so long, so the fact that they finally approved it is amazing. But before we get started, would you mind maybe sharing a little bit more about yourself?
Yeah, so I have been interested in nutrition and weight since really as long as I can remember. And when I went through med school, I remember thinking there were so many underlying medical problems that could be prevented or treated through weight. So when I was in residency and discovered there was a whole field of obesity medicine where I could do this full time and treat weight and metabolic health as the underlying medical issue as opposed to putting Band-Aids on other things, I jumped in and never looked back. So this has always been a really important part of how I treat patients' medical problems. And it has changed so much over the 10 years that I have done this. And it's so exciting to have new tools. But yeah, so that's me. And so I'm a family physician. I do obesity medicine. And then I have a podcast where I talk about this stuff all the time. I have a course for physicians where I also help doctors learn how to treat obesity because we need more people doing this.
Yes. I was talking to a group of primary care and I'm like, listen, we need you. We need you. So that's excellent. So you're able to give these doctors the tools they need in order to be able to go back into their clinics and make a difference. That not only are you treating their weight, but you're treating their metabolic problems with weight loss. So that's amazing. Well, let's get right into it. What exactly is Zepbound and what's the difference between Mounjaro? Can you just break that down?
Yeah. So Mounjaro and Zepbound are, for all intents and purposes, the same thing. They are both tirzepatide, and it looks like the little pen that they're in, the pen needle, looks exactly the same, except it has a different name on it, which is Zepbound. So we have been using Mounjaro for about 1.5 years for diabetes. Some of us jumped ahead and started using it for weight because we saw the data and we felt confident that was a safe thing to do for our patients. But they are the same group of medications with different indications based on what the FDA approved them for. And they're a group of hormones called incretins. We've had a couple in the past that worked similarly. We've had Wegovy and Saxenda for weight loss that worked on a hormone called GLP. So a lot of people have probably heard that term, GLP, and that's one of our gut hormones that makes us feel full and can make us feel full at the stomach level, but also can start working on brain hunger. But what the Zepbound brings to the table is action on a second hormone called GIP, and it actually works a little more strongly on this GIP hormone. So it's our first one that works on 2 different hormones. And again, it increases that stomach hormones that makes you feel full. It slows down gut emptying, so food stays in your stomach longer. At higher levels, it starts to work on that brain hunger. And it looks like this GIP hormone might also change how we metabolize fat a little bit and make it a little less likely that we store it and make us a little more set up to burn it, which may be why it's a little bit more effective. We're still trying to figure out why this combination of hormones is so effective together.
Oh, yes. Well, what is the average weight loss that people lose with this medication?
Yeah, so for patients who have obesity and are being treated for that, as opposed to the people who are taking the Mounjaro for diabetes who don't lose quite as much weight, people who are just taking this without diabetes have about a 20% weight loss on average with this medication. So of course that means some people will have less, but it also means that some people have more. And I was just looking at the data before we popped on, and actually up to 1/3 of people have a 25% weight loss. So 1 in 3 people will have that 25% weight loss, which is, close to what you get from a bariatric surgery. So pretty impressive. Our previous best medications had maybe a 15-16% weight loss. So this is definitely a huge leap ahead in how much weight people can possibly lose from a medication.
Yes, you're absolutely right. It's a game changer. We're changing the way we're able to lose weight and affect lives, most importantly. Now, going back to just how it works, you mentioned that it works at the level of the brain with brain hunger. What does that mean a little bit?
Yeah, so I have a whole podcast episode where I talk about different types of hunger, and some people may never have thought about this, but there's lots of different ways that we feel hunger and fullness. And, hunger, is broken down to a few different things. So that can be cravings, thinking about food. That can be your stomach feeling empty, like you need to eat something. But a lot of times people will have this sort of chatter in this brain telling them that they need to eat. So even right now, as I'm sitting here with you, I'm starting to think like, I'm a little hungry. I could have dinner. What should I be eating, right? And for some people, that thought about food is a lot more intense and more common. And so we see that for a lot of people, that decreases with the medication. And then on the flip side, there's more that feeling of fullness. And I think we have underappreciated that in the past. I think we focused a lot on hunger, but we have forgotten that some people are not full as easily. And so you may not feel hungry all the time, but when you do eat, you might eat too much at a time because your body's not telling you you're as full. And so the medication works primarily on that fullness. It's a lot easier to eat a small amount, but we do see for people that they also get rid of that brain chatter, that thinking about food. So it works really on both sides for most people, which is pretty powerful.
Yeah, and I found too in my patients that it really helps them to be able to make wiser decisions because they're not thinking about it. They're not thinking about
right. Yeah, if you're hungry, you want these more palatable foods, right? The hungrier you get, you'll eat whatever you see, and you start craving things. You're like, oh, I want a cheeseburger, I want pizza, I want pasta, whatever your favorite food is. But if you're not that hungry and you're just like, I should eat, it's dinner time, or my body's telling me it's getting a little, hungry, then it's a lot easier to be like, I'll just have some chicken and veggies, as opposed to when you're hungry and you want a lot of calories because your brain is telling you need a lot of food.
Oh, yes. Now, you mentioned the indications for Zepbound. Who was this for, actually? Mm-hmm.
Yeah, so it's based on BMI criteria, which, we could talk about whether or not BMI is the best way to determine if someone has a problem with their weight or not, but that's where we're at right now with our FDA approvals. And so for people with a BMI of more than 30, which is just a height to weight ratio, you can find that calculator easily online. A BMI of more than 30 qualify for the medication, or a BMI of 27 or more with a health-related condition like, say, high blood pressure, high cholesterol. Those would be another reason to take the medication if your weight is not quite in that, quote, obese zone, but you are overweight and have a medical condition associated with it.
Awesome. And so I know some of the, critics kind of, are saying that people use this for, more vanity, and it's really not meant to be that. It's supposed to really help people who are in the BMI greater than 27 or 30 to lose weight.
Mm-hmm. Yeah. And we'll probably talk here in a moment about some of the side effects, but all medications have side effects and potential risks. And so if something is just being used more for vanity to lose a quick few pounds, well, any risk may not be acceptable in that case. But we know that people who have those BMIs above 27 with a medical problem or a BMI above 30 are more at risk for things like heart attacks, diabetes, cancer. And so if we can help them lose weight and prevent those things and there's a small risk of a side effect or a serious side effect, then that is more likely to be worth it than, again, taking it for a short period of time to lose weight for a trip or something.
Exactly. I exactly agree. And let's get into those side effects. Kind of what are the side effects that one should expect with this medication?
So the medication works on some of those gut hormones. And so as a result, most of the side effects are going to be gut related. So nausea is by far the most common side effect, as well as some dyspepsia or reflux, some sort of upset stomach that can happen. A big trigger for that upset stomach is often eating too much if you're not used to the medicine telling you don't need to eat quite as much, or eating too close to bedtime. The food does stay in your stomach longer. And so if you're used to eating right before bed or eating a late dinner, that may not work very well with this medication and may increase that side effect. We will also see people get constipation or diarrhea, which is interesting because those are opposite side effects. And interestingly, both of those can be improved by taking a fiber supplement. But your doctor can help navigate those side effects and, help you figure out the best way to treat those. But not everyone gets side effects. So those are going to be, the most common ones are some of those stomach upset. And then, there can be more rare side effects. There's a concern it could cause an inflammation of the pancreas called pancreatitis. It looks like that's pretty rare. And then it can also cause a severe slowing down of your stomach called gastroparesis. It also looks like that is going to be a very rare side effect, but we're starting to see a few cases of that in this group of medications. So mostly gut stuff is the main side effect. And then anything where you lose a lot of weight, you can have side effects like gallstones or hair loss. So we see a little bit of that on this medication as well, but that's more a side effect of losing a lot of weight. And that can happen no matter how you lose a lot of weight.
Oh, yeah. Now, is there any particular group of people that are contraindicated for this medication?
Yeah. So none of our medications for weight are approved for women who are pregnant or breastfeeding. And then this particular group of medication, these injectable weight loss meds, are not to be used in people who have had a history of medullary thyroid cancer, so a very specific cancer, or a family history of that cancer, or have a family history of something called MEN2, which is a very specific syndrome. You would probably know if it was in your family. But those are both pretty rare conditions, but something that if you have, we don't want you taking this medication because it could increase your risk of cancer for that specific group of people.
Oh, awesome. Awesome. Now,
And then, of course, you should always talk to your doctor, right? Because there's meds it could interact with something else. There may be a better medicine based on your heart health or kidney health or something else. So lots of little things that need to be customized to individual patients, but those are the really big ones.
Oh, definitely. And it is important, regardless, that you definitely see your doctor, let them do a history, a physical, just to make sure that this is the right medication for you. I know I have a lot of patients that get so excited and they're like, when should I expect to lose weight on this medication? Like, I know, when do you see people in your practice who are losing weight, or when does it start, I guess?
Yeah. So I generally encourage people to weigh themselves once a week and not much more than that. But people definitely can lose weight the first week that they're on the medication. Some of our other medications, people would lose a lot of the weight in the first 3 months or so, and then maybe not lose more, like phentermine, which I've used for a long time. But with this medication, what I've seen for my patients and what the data also shows is that people keep losing weight for a while. And so even after a year, people are continuing to lose weight on this medication. And so it's a long game on this medication. So you will lose some weight initially and it will slow down, but you're likely to continue losing weight for more than a year on this medication.
Well, for somebody wanting to take this medication, what are some lifestyle changes that they can make to help optimize their weight?
Yeah, so eating regularly is really important on this medication because most people will not be as hungry and will feel a lot more full. They will eat smaller portions. And so the type of food becomes a little more important. A lot of people have to really focus on getting enough protein in throughout the day. I encourage all of my patients on this medication to eat 3 meals a day that have some protein. And sometimes that's a really small meal, like a Greek yogurt or a protein bar or a protein shake or a couple of eggs. It doesn't have to be an elaborate meal, but eating protein 3 times a day, I think really sets people up for success because some people don't eat very often. They've gotten in that habit and they're used to eating maybe 1 or 2 big meals. And you just can't do that on this medication. You don't have room for a really big meal. So you might miss out on some of the protein or other nutrients you need if you don't eat at least 3 times a day on this medication. So 3 times a day balanced meals is usually the best way to eat on these medications. And then exercise, of course, is additive. And so exercise is important for all of us to live longer and live better. It shouldn't feel like a punishment because you're losing weight. Elaborate exercise does not have to be as elaborate. It can be walking and yoga. It doesn't have to be doing anything crazy. But that's going to really add to the health benefits and probably the weight loss benefits and your ability to keep weight off long term on this medication.
Oh, awesome. So those are really great strategies for people. So if you didn't hear her, definitely eat at least 3 meals a day, making sure you get your protein in, protein, and then making sure that you're physically active. Well, thank you so much for coming on the podcast and just telling us all the things about Zepbound. But how can somebody work with you?
Yeah, so I only practice in Colorado. My clinic is the Colorado Weight Care Clinic at Green Mountain Partners for Health. But we can see people anywhere in Colorado. And if you just want more health tips, please check out my podcast, The Dr. Francavilla Show, where you can learn about other medications, other skills around weight that I hope will be really helpful for people as well.
Well, thank you, Dr. Francavilla, for coming on and just sharing everything. And for those who are listening, thank you for joining us today on the Back on Track Achieving Healthy Weight Loss. If you like this episode, please feel free to share it with others, like it and subscribe. And don't forget to leave a 5-star review. And we'll see you all next time.